Hey guys, my name is Triana, and today I'll be talking about pharmacology and the principle of drug administration.
Pharmacology is a science concerned with the origin, nature, effects, and uses of drugs. A drug is any chemical substance that produces a biologic response in a living system. A drug is a substance used as medicine to aid in the diagnosis, treatment, or prevention of disease. Here we have two drug classifications. The first drug classification is the chemical name. The chemical name is a single drug and it represents its actual chemical structure. The second classification is the brand name. It's unique to the company that manufactures the drug. Now we have the physician's desk reference, also known as the PDR. It's a reference that lists drugs by both generic and trade names. It's mainly found in the radiology department. Now we have some dosage forms: tablets, capsules, inhalant, suppository, suspension, and transdermal patch. Here in the images, it shows you most of those. Now we have 4 influencers of drug action, which is 1, the patient age, 2, the medical history, 3, any medication being taken, and 4, the disease state of the body. Now we have a list of the medications that we mainly use in X-ray. We have Lipitor, which it can treat high cholesterol levels. This may reduce the risk of angina, stroke, heart attack, heart and blood vessel problems. We also use Benadryl. It's in its oral form, it can treat fever, allergies, cold symptoms, and insomnia. In injection form, it can treat severe allergic reactions and motion sickness. Hydrocortisone. It's natural substance made by the adrenal gland. It is used to treat conditions such as arthritis, blood, hormone, immune system disorders, skin, and eye condition and breathing problems. We also have nitroglycerin. It can treat and prevent chest pain in its oral form. When used rectally, it can treat pain caused by tears in the skin around the opening for bowel movements, also known as anal fissures. We also use lidocaine. It can treat irregular heartbeats, also known as arrhythmias. It can also relieve pain and numb to the skin. We also use epinephrine. It can treat severe asthma attacks and allergic reactions, including anaphylaxis, in an emergency situation. We also use norepinephrine. It can treat low blood pressure and heart failure. And metformin. It can treat type 2 diabetes. Due to x-rays, it must be stopped for 48 hours post-injection. And now we have another little list. We also use ferumoxytol. It can treat iron deficiency anemia in patients with chronic kidney disease. Atropine. It can treat heart rhythm problems, stomach or bowel problems, and certain types of poisoning when injected. It can also decrease saliva before surgery and dilate the pupils before an eye exam. We also use naloxone. It can treat narcotic overdose in an emergency situation. Also, propofol. It can cause relaxation and sleepiness before and during surgery and other medical procedures. Tamoxifen. It can treat breast cancer. It may also prevent breast cancer and women at high risk of developing it. OxyContin. It can treat moderate to severe pain. Valium. It can treat anxiety, muscle spasms, and seizures. Ativan. It can treat seizure disorders such as epilepsy. It can also be used before surgery and medical procedures to relieve anxiety. And the last little chart, we also use lisinopril. It can treat high blood pressure and heart failure. It can also reduce the risk of death after a heart attack. Motrin. It can treat fever and mild to severe pain. Lipressor. It can treat high blood pressure, chest pain, also known as angina, and heart failure. This may lower the risk of death after a heart attack. We also use amoxicillin. it can treat infections and stomach ulcers. Coumadin, it can treat and prevent blood clots as well as warfarin. Heparin, it is used to decrease the clotting ability of the blood and help prevent harmful clots from forming in blood vessels. Zoloft, it can treat depression, obsessive compulsive disorder, post-traumatic stress disorder, and premenstrual dysphoric disorder, social anxiety disorder, and panic disorder. Glucophage, it can treat type 2 diabetes. Zofran, it can prevent nausea and vomiting. And diflucan, it can prevent fungal infections. And now we have here a list of 4 drug reactions. We have allergic, idiosyncratic, iatrogenic, and anaphylaxis. Here are some response factors. We have absorption, which is drug movement from its site of administration into the blood. Distribution, which is drug movement from the blood to various tissue and organs of the body. Metabolism, which is chemical alteration of various drugs. And excretion, which is drug movement out of the body. And now we go into the principle of drug administration. We have to know the 5 drug rights, which is the right patient, right drug, right time, right amount, and right route. Next, we have the drug route. We have a couple different types of drug routes. We have oral, sublingual, which is under the tongue, intramuscular, which is into the muscle tissue, subcutaneous, which is under the skin, rectal, which is rectally, parenteral, which is using syringe and needle. This is mainly used in a case of an emergency. Topical, which is onto the skin. Buccal, which is against mucous membrane of the cheek of the upper or lower jaw. And intravenous, which is directly into the vein, which gives us a rapid response. Here I drew like a little chart so you guys kind of get like the gist of it. Pretty sure we all do by now, but just in case. Drug error. Drug error is the most common legal problems. It's immediately to be reported to the physician, to the nurse, to whoever you come across to first, and you have to follow the protocol of the site that you're at or wherever you're working. Next, we have the references. And then, ta-da! We're finally done.
Bye guys, thanks for watching.